So now you have decided to get your nose done but torn kayo between silicone or Gore-Tex? Sa video na ito, I'm gonna give you the pros and cons between silicone and Gore-Tex nasal implants. Let's go! What's up guys? Doc Reg here, Certified Cosmetic Surgeon, and welcome to Doc Guides. In this channel, I give tips, advices sa skincare, aesthetic procedures, at iba pang papaganda, as well as health and prevention, and some product reviews. So if you're new dito, consider subscribing at sana marami kayong matutunan. Okay, there are many types of nose lift or what we call augmentation rhinoplasty. Take note, nose lift is different from nose job. Gusto nyo malaman ng difference? Make sure to subscribe and post it down sa comments. So for now, focus lang tayo sa nose lift at sa two most common implants used. We start with Gore-Tex nasal implant. Hindi ko mabuksan kasi gagamitin ko. It is porous, meaning para siyang sponge, kaya yung tissue surrounding it integrates with the implant and making it more stable and attached sa mga nasal structures. Dahil sa characteristic na yon, it gives a more natural looking effect. And if ever, knock on wood, hindi naman maiwasan mag-infect, kayang maabot ng antibiotics hanggang dun sa implant. And also, sa extreme heat na temperature, hindi affected ang Gore-Tex. So, there are I types, and also there are L types, or from a block, and also sheets. Ito yung mga ibang shapes. Now, sa cons you ask, first and foremost, expensive ang material. And also, may special instruments needed para mailagay ang implant. That's why, ganun ang price niya. Next, if ever, hindi gumana yung antibiotic and you'll need a revision rhinoplasty, mas mahirap ang removal ng Gore-Tex kasi nga may laman or structures na mismo dun sa implant. That's so gory, Doc. Sorry. Gore-Tex also has a tendency to shrink. But, tandaan nyo, kaya niya ang heat. So, ito yung mga considerations na dapat nyo pag-isipan. Then, these are silicone implants. Pwede ko ito buksan para mapakita ko sa inyo. So, ito na siya guys. These are L-type na US. So, ito na siya. This is the hard and this is the soft. Nasimulan ko na siyang makarve. Manipis lang yung kakailanganin ng patient. This is for the really low bridge or almost flat. Mas maganda yung mga hard type para mabigyan ng definition talaga yung bridge. Silicone is very easy to carve, pero may mga bagong lumabas. This is called the Swan type. Ayan. Meron tayong iba like the Mantis type. Marami pang bagong mga lumalabas. Meron mga hybrid. Pero ito siya, kahit silicone siya, yung shape niya naka-contour na to give a more natural look. Yan. Ano talaga yan sa ilong nyo? Kailangan ko pa ba? Ayan, ito yung mga bagong type na mga silicone implants. Available na ito decades already and mas master na ito ng mga surgeons. Since mas madali ito ilagay and knock on wood, in cases na magkaroon ng infection or pag gumalaw, madali lang itong tanggalin at i-revise. Silicone is also easier to carve and shape, so mas customized on each patient, on each and every one of you. Cheaper din ang material, so expenses would be significantly lesser. Maraming shapes and types din ang implant na ito kasi nga matagal na siya and marami pang lumalabas. I-type, L-type, Swan, Mantis, hard, soft, special, or the hybrids. Ito, ganito yung hybrid. Doon sa bridge part, medyo mas firm yung material. Silicone pa rin, pero doon sa tip, mas soft. Ano ang cons niya? Cases ng implant rejection. Well, pareho naman ng Gore-Tex at silicone, merong cases ng implant rejection kasi nga foreign body pa rin siya. Better pa rin ang cartilage. More on cartilage rhinoplasty on another video. But more cases lang sa silicone. Okay, implant rejection, dyan nakasali yung protrusion, migration, malposition, kaya gumagalaw or tumatabingi, Pwede kasi while healing, yung isang side matagal gumaling, yung isang side naman medyo nagre-react siya. So, pwedeng gumalaw yung implant. Nangyayari yon but not always. One significant feature ng silicone implant, it doesn't shrink. Hindi siya lumiliit kahit gaano katagal. But, affected siya sa extreme heat. Kalma lang, huwag kayong mag-alala. Extreme heat lang naman. So kahit buong araw kang nakababad sa beach o sa sauna, or kahit nag-iihaw ka buong araw, okay lang yon. Kahit bumbero ka pa, hindi yan affected. Ganun pala, Doc. So final thoughts to think about. If ikaw yung type na sure ka na basta tumaas yung bridge mo at mas prefer mo ang stable at more natural yung feel, and if you have the budget, go for the newer technology which is Gore-Tex. But if you're the type na may tendency ka magpalit ng implant sa future, go for silicone. Mas affordable siya and may room ka for improvement if ever lang kailanganin nyo. Also, may mga hybrid na, tsaka kina-carve namin yan per patient. So, customize yan on each of you. Usually, na-advise ko to sa mga first time and dun sa mga nag-aalala, baka hindi nila magustuhan yung nose nila. Pero syempre, I make it a point or we surgeons make it a point na yung procedure na yun na yun at happy tayo pareho. All in all, both implants has complications. And it comes down to how comfortable you are with your surgeon. Pwede nga magaling nga yung surgeon, pero masungit din, di mo na makausap after ng surgery. That's not good. Consider nyo din, exposed ka ba sa extreme heat? Baka nagtatrabaho ka sa bulkan, edi Gore-Tex ka. Pero again, sa katagalan, pwedeng lumiit ang Gore-Tex. Ulitin ko, pwedeng lumiit. Not always. Ang silicone, hindi siya liliit. Pero yun nga, affected siya ng heat. I won't say dito ka sa silicone kasi mas mura and mas expensive si Gore-Tex. Parehong quality yan. And kaya yan mapag-ipunan if you really, really want. Personal opinion ko, me, I'd go for silicone. Kasi sa hybrids, and it's quicker to place and remove if needed. And from personal experience, I have silicone implant din. Not sa nose, pero sa chin. So guys, I hope makatulong ang video. Subscribe so you'll see more of these kinds of videos. Stay safe and comment down below which implant do you prefer or if meron nang nakalagay sa inyo now, and I'll see you on the next one. Bye!